Prolapse is a condition that some women are reluctant to talk about. Dr. Michael Bonady, a urogynecologist and the director of robotic gynecology at UPMC in the Pittsburgh area, specializes in the condition.
There's so much misunderstanding on this subject matter. Like everybody comes to me and says, my bladder is prolapsed, and nobody's bladder is prolapsed.
Right.
It's the vagina. I think we've traditionally been afraid to say the word vagina, and that's why we say it the way we do. But it makes patients very confused about what's going on with their own bodies.
Prolapse mostly occurs in postmenopausal women who have given birth. Dr. Bonady says it happens when the pelvic floor, or the muscles that sit beneath and beside the central organs of the pelvis, weaken.
That combination of the ligaments that suspend the vagina and uterus being injured and the weakening of the pelvic floor musculature, and then forces of life over time, right? It's not like an immediate. That leads to the vagina and or uterus or both prolapsing.
One of the main symptoms of prolapse is pelvic pressure, as well as a protrusion that can impact standing, sitting, even walking. There are non-surgical options to treat the symptoms.
So pelvic floor physical therapy is an option, and then pessary. It's a rubber-like device that can fit in the vagina and hold things in place while it's in there. It doesn't repair the problem, but it can treat the symptoms.
There are also a variety of surgical options to repair prolapse.
The robotic approach to prolapse repair is one, but it's not the only one. So there's transvaginal approaches and transabdominal approaches. The robotic thing that I do is transabdominal, but it's not what we do for everybody. We individualize the treatment based on patients' needs and choices.
Robotic prolapse repair surgery is an outpatient procedure, and the recovery time isn't as bad as you think.
I tell them, like a month off of work, depending if a patient does a lot of heavy lifting at work, maybe 6 weeks. But it's a month of minimized activity, particularly minimizing lifting.
If you have prolapse treatment and repair questions, talk to your doctor. For this Healthwatch 16 report, Carrie Kearns, Newswatch 16.